My name's Nick Moberly. I'm Chief Executive at King's College Hospital NHS Foundation Trust, which is a major teaching hospital and academic centre based in South East London. King's is one of the most famous and biggest teaching hospitals in the NHS, with a long-standing tradition not only of teaching excellence but of research excellence. We are also a major general hospital for a large population in South East London, covering about 1 million people. King's is known as a specialist centre particularly for liver services, including transplantation, haematology, including bone marrow transplantation, and is a major centre of neurosciences as well. It's a hospital which turns over about £1 billion annually and employs about 13,000 staff. The NHS, like many other health systems internationally, faces huge pressures at the moment. There are very high aspirations in terms of delivering world-class levels of quality, but of course we face, like everyone else, very significant funding pressures as a result of significant underlying growth in terms of healthcare costs. So in terms of general hospital services, payers are absolutely insistent that King's continues to provide an outstanding acute hospital service to the local population, albeit there is a big policy focus on trying to deliver more care in the community. Back in 2013, we acquired a district general hospital on the outskirts of South East London in Bromley called the Princess Royal University Hospital. There was an interest on the part of King's in acquiring the Princess Royal because it would increase our overall scale and the size of our catchment. The acquisition was very challenging, therefore in the early days became a huge drain on the relatively limited management resource within King's as a whole. There's been huge progress made in stabilising the Princess Royal Hospital and improving therefore the quality, the operational performance and actually the financial performance as well. Our vision is to deliver the best care globally through innovation and continuous improvement. And what that means is we're striving to deliver consistently and sustainably the very highest standards of healthcare for the patients we serve. There are occasions where the acute medical workload can overspill into some of our specialist areas, and that can have implications for our ability to run our specialist services effectively. Having said that, I'm extremely proud of the standards of quality that King's currently delivers. In terms of outcomes, the biggest performance shortfall we currently have at the moment really relates to patient experience. And we know that the great majority of our patients are very satisfied with the standards of care and experience that they receive, but if we benchmark ourselves against the totality of the NHS, actually we're no better than average, indeed possibly slightly below average. Our mortality is amongst the best in the NHS, and if you look at some of our specialist services where it's possible to benchmark specific outcomes at a service level, they are absolutely up there with the very best globally. Fundamentally, one of our strategic objectives is to make sure that we get the capacity of the organisation more aligned to the growing demand that we are experiencing both in our specialist services and in our general services. We are looking to build our specialist service portfolio in conjunction with partners in King's Health Partners and really establish those at international best-in-class level. We're looking to drive forward on the integrated care agenda, which is a big thing in the NHS at the moment, and that's all about moving care increasingly into a community-based setting and joining up primary care with acute hospital services in a much more seamless way. We're looking to consolidate clinical support services such as pathology, where we already have a partnership with Guy's and St Thomas's Trust, which can be developed and extended. And there's a range of other collaborative opportunities that we're working on, including the consolidation of back office services, for example, or working together with other partners to increase our procurement scale such that we can get better prices for some of the consumables that we buy in. A final strategic objective for us is to lower our costs of capital. King's at the moment, for a variety of reasons, has a very high capital cost, and in particular that relates to the fact that we have a couple of large private finance initiative funded pieces of our infrastructure which cost a lot in annual rental to maintain. So we're going to be working with colleagues at the centre of the NHS to see if there are ways of refinancing some of our capital costs and reducing the finance pressures that we currently face.